Hi, everybody. I thought I would get on real quick and talk about how to thrive if you've been diagnosed with polymyalgia rheumatica. Polymyalgia rheumatica is also known as PMR, and I know it sounds like a mouthful, but polymyalgia rheumatica is an autoimmune condition where there's inflammation in the muscles and tendons. So typically, it's like the shoulder muscles and the thigh muscles. And I want to talk to you about how to thrive if you've been diagnosed with that. So my name is Dr. Arinola Dada. I help people with autoimmune diseases get the immune system back on track, and people with joint pain become pain-free. So let's talk about polymyalgia rheumatica, or the short form of it called PMR, and we'll talk about how you can thrive when you've been diagnosed with this condition. So we're going to talk about three things, and we're going to get right to it. So one, most important thing is that polymyalgia rheumatica is treatable. So that's one thing you need to know. Polymyalgia rheumatica is treatable, but it's treatable with prednisone. And your doctor and all rheumatologists have a love-hate relationship with prednisone. It's great because it's a wonder drug, but it's bad because of its side effects. And so we're always trying to figure out, once I put a patient on prednisone, I'm immediately thinking about our exit strategy. How do we get off this prednisone, right? So number one thing that you need to know is confidence that yes, this is a treatable condition, but that there are side effects of prednisone, and that's one of the things that you need to watch for. So your muscles and tendons, your ligaments get inflamed, the tendons get inflamed, it can make you deconditioned. And also when you're treated with the prednisone has an adverse effect on your muscles. So very quickly, between the inflammation in the ligaments and tendons, and then the steroid myopathy, that's what it's called when steroids can affect your muscles, very quickly you can find that you develop a lot of significant muscle weakness by the time you're off the prednisone. So once things are stabilized, the diagnosis is made, you and your doctor are on board, one of the things that you should be doing is starting an exercise program. So exercise program is walking, hiking. We want to try to avoid high impact things. So we want to encourage things like swimming, elliptical. Sometimes I find people who are not able to do the self-directed exercise program. Sometimes we have them do physical therapy. So the number one thing is you're going to be fine. It's going to require prednisone, and the prednisone is likely going to be there for 1 year. So we want to make sure as the prednisone dose is being lowered that your muscles are not adversely affected. So one, prognosis is good. You're going to be on prednisone for at least a year, but there are things that we need to do to make sure that you do okay. So that's number one. Number two, one of the side effects of prednisone that treats PMR or polymyalgia rheumatica is that it's also bad for your bone density. So right off the bat, you should be taking foods that are rich in calcium. And we've talked about, milk, dairy products, cheese, yogurt. And for people who are intolerant to that, nuts, almond nuts are very rich green leafy vegetables, including things like broccoli. And then canned seafood, if you think about sardines, those things have high calcium intake. Calcium citrate is the best absorbed calcium. So also thinking about calcium citrate, but talk to your doctor because, for instance, people with kidney stones cannot really be taking that much calcium, right? So talking to your doctor about calcium is important. So that will be number two. And then number three is the biggie, okay? That's the elephant in the room. About 1 in 10 people with polymyalgia rheumatica can have this inflammation in the blood vessel to their eye. And that usually presents with headaches. Their scalp gets really tender. Sometimes they have double vision. Sometimes they feel like a curtain came over their eyes and lifted. Sometimes they have like Charlie horses in their jaw, right? This kind of headache, you take some Tylenol, it does not go away. Now I'm going to tell you a story. When I was a resident, I think I probably was a senior resident because I had a lot of time on my hands. So I would remember I would always kind of go to my patient's room, just kind of check on, make sure that my patients were all tucked in for the day. And I remember going to this gentleman, lovely guy. And so we were just chit-chatting, telling me about his life. And he said, hey, Dr. Dada, you know, I lost vision in my right eye a few weeks before I came into the hospital. He was hospitalized more for cardiac issues, right? And they'd fixed it and he was about to get discharged. So we were just having a nice little chit-chat. And he says, you know, I lost vision in my right eye. And I'm like, tell me more. And he said, well, I didn't want to tell anybody, but I had this double vision for a while, and then I had these headaches, and then I lost vision in the right eye. And I said, well, how are you feeling now? He said, well, I'm actually telling you this because I'm actually having something similar happen in my left eye, and I feel like I should probably tell someone about it. Yeah, before I lose vision in the eye. And I said, I am so glad you shared this information. And we went ahead, we did some tests, found out we had this GCA, which is Giant cell arthritis, which is what can happen in 1 in 10 people with PMR, right? So luckily for him, he spoke up, we treated him, he still has a left eye, but unfortunately, because the gap in the time he reported the right eye issue, we were not able to restore vision to the right eye. So the take-home point from that is if you have polymyalgia rheumatica, you start having headaches, scalp tenderness, jaw claudication, that's cramps in your jaw when you eat, that is an emergency. You do not sleep on that. You call your doctor, you go to the emergency room, they'll treat you and then decide, how to handle it long term. But very important that you report it. Your doctor is going to keep talking to you every time you come in ad nauseum, just because they want to make sure that you don't lose vision, because it is reversible when it is caught early and can become irreversible if there is a delay in recognition. So 3 things, like I said, that will be helpful for you if you've been diagnosed with polymyalgia rheumatica. 1 is don't get anxious. It can be treated. It requires prednisone. There are some other options that your doctor can talk to you about, but this is the basic. And then the most important thing is then protecting yourself from prednisone. So whether it's an exercise program, graduated, we don't want any high impact. Number 2, protecting your bones. So calcium, vitamin D2 is important. And then 3, realizing that there is an association with a condition called GCA, or giant cell arthritis, that can cause inflammation in the blood vessel to your eye and can put your vision at risk. So my name is Dr. Arinola Dada. If this video has been helpful to you, share it or like it. If you are in the greater Seattle area, look us up and we'll be happy to help you towards your journey of a healthier you. You take good care. Thank you.